Good evening. I'm going to call this meeting of Health and Human Services Committee to order. Thank you all for being here. My name is Eli Sabin. I represent Ward 7 on the Board of Alders and I'm the chair of the committee. And I will start by reading the notice and then have my colleagues introduce themselves. Board of Alders, New Haven notice. The Health and Human Services Committee will meet in person on Thursday, December 12th, 2024 at 6:30 p.m. in the Board of Alders Chamber, 165 Church Street, 2nd floor, New Haven, Connecticut, to act on the following items. LM-2020-0703 from Alder Sabin Furlow submitting a request for a public hearing regarding asthma and related public health challenges in New Haven to discuss and develop potential solutions. This item is on file available for public inspection in the Office of Legislative Services, 165 Church Street, New Haven, Honorable Eli Sabin Chair, attest Honorable Michael Smart, City Clerk. If you need an accessibility related accommodation, please contact 203-946-7651 or 203-946-8582. In accordance with City of New Haven COVID-19 policies, masks are optional. The public may send comments to public testimony at ACT.gov. My colleagues, starting on my left.
Alder Singh, District 5.
Sarah Miller, Ward 14.
Tommy Smith, Ward 9.
Thank you, your colleagues. And, one of the makers of this item, our Majority Leader, Alan Furlow, has been pulled away to another meeting. He may be here at some point soon, but I'll acknowledge him as well. So our plan for this evening is to start with some presentations from the state staff, beginning with the health department, and then LCI, and then have some public testimony. The purpose of the item that is before us here is to start a conversation that I think is overdue in our context here at City Hall, but obviously is a conversation that affects many families around our city. That's the issue of asthma and mold, which are really important public health challenges that affect so many residents across our city and are tied up with all kinds of other issues that we confront in our community, including housing and healthcare and environmental justice issues. So I'm excited for the conversation and grateful to everybody for being here, especially folks who work every day with people in our community, helping make sure people have stable housing and safe conditions. We're here to hear stories, and we also may have some residents, obviously also, and it's difficult to get out this time of year. But it's an ongoing conversation that we're looking forward to starting out today and hoping to develop some solutions by coming out of this meeting. So enough throat clearing there. Thanks everybody for being here, and I'll start by calling up Director Bob from the Health Department.
So I'm going to plug it in. Do I have the phone? We have copies of the public.
We'll go our staff.
My computer. And I emailed them to Adam. Thank you.
Let me see what my Outlook is.
Everybody else first, yeah. Start by giving us your name and address for the record.
Margaret Stevens, 424 Tower Street, New Haven, Connecticut.
Thank you. And I guess one thing to note, there may have already been told us, but there's a sign-up sheet for public testimony on the wall over there, so I hope you have time.
There you are.
Thank you so much, Mr. Lucas.
You're welcome.
Good evening. Thank you for the invitation to be able to discuss an important topic that impacts many of the residents in New Haven and across the state of Connecticut as well, as the United States. And so today what I wanted to do is discuss the impact of asthma in New Haven compared to the state of Connecticut nationally, describe the area of New Haven with highest asthma rates, talk a little bit about some services we offer to reduce asthma rates, such as healthy homes and our summer program that we've done in the past, and also provide an overview of opportunities for expansion of services. And so what you see in front of you, I can stand up. Oh, well, then I'm not. You sure? I can stand up. I'm on party line. You sure? That's the moment. So the combined asthma rate for emergency, what is the map of the combined asthma emergency department and hospitalization census tract in New Haven from 2010 to 2014. The data that you see for you is really data that is published by the Department of Public Health. One of the things that we do is we also do monitoring. So as you can see, the highest, the darker the color, the darker the rates are across the regions that we are seeing. I'm going to highlight momentarily also the different demographics as well by neighborhoods. The next slide that you see, which is the Data Haven Community Wellbeing, and this is also made available on their website, is the childhood asthma hospitalization encounters. And as you can see, we have significant in comparison to surrounding towns, Maven being in the dark brown, as you can see, Amity, Westville, and the Hill have some of the highest rates. New Haven is at 17% for adults, 18% over, as compared to 13% of the state of Connecticut. So, comparison, New Haven is at 100. Because, and this is also according to the 2015 health survey, asthma rates from 2009 to 2015 in New Haven, 6 of the lowest income neighborhoods, 6 Welfare Haven, Hill, North Newville, West Village, White, and West Park, West Rock, and West Hill increased from 20% to 23% compared with averages, as I noted, at 14% and the US at 13%. And so that is alarming numbers because, as you all know, I've presented different workshops in the past, and these are that are impacted with other social drivers, like having the highest lead cases as so there's some similarities of different social drivers that are affecting the community. In 2015, there's among women and Black and Hispanic Latino communities, as well as lower income residents, making asthma a critical health justice issue in New Haven. The next slide, as you see in front of you, asthma in New Haven is ranked high in the nation. And so we wanted to just show you that we're in the nation. And that's alarming when we are the third largest city in Connecticut of 138,000 residents. And here we are seventh in the nation. And so that's also something that I wanted to highlight as well as looking at it from the top 100 most challenging places to live with asthma, New Haven rated 24 in the nation. So that's also alarming. As we look at asthma rates as well of school-aged children between 2022 and 2023, and we look at acute rates of children because we oversee the districts, overall prevalence on 6%, males at 18%, females at 14% respectively. And looking at the demographics and looking at non-Hispanic Black, 19%, Hispanic 60%, and non-Hispanic white at 11%. New Haven was the five cities in Connecticut with the highest chronic absentee. No. The next slide is just the Yale Global Health Justice Partnership. As Marking Group of 2017 reported that the most significant disparities in New Haven is gender, income, and race. 31% for women versus 15% for men. And individuals in the lowest income bracket at making less than $15,000 had the highest rate of asthma at 30%. Looking at the Black community, 20%, Hispanic Latinos at 25%, was also notably higher as compared to white individuals at 20%. New Haven has the highest rate of asthma hospitalizations, as noted, in the state of Connecticut, weighing in at 75 per 1,000 residents compared to the statewide rating of 46 per 1,000 residents. So I thought that it was important to have a comparison of different studies that are all consistently saying the same thing. And what are some of the causes, right? So I mentioned social drivers, and poverty is one of them, and also looking at inadequate remediation of poor housing conditions and environmental triggers, alongside lack of proper medical treatment and education. Places like in particular, covering children are high risk. And so I just wanted to sort of highlight a mapping of that, just to show you a different illustration. You all know in the city of New Haven, our housing stock is significant. We have the largest housing stock of houses built before 1978. There's a challenge that not just my department has to face, but LCI, who will be presenting after me. Housing conditions that even contribute to these health issues of our residents. 51% of housing units were built before 1940, in contrast to the national average of 13%. 22% of households live below the federal poverty line, national average of 11%. 72% of households are rented, while the national average is only 36%. That's significant because that is an issue around then investors who decide that they want to invest in rental properties and the impact that that has on the communities. I'm sure LCI will shed some light about their challenges. There's also financial constraints that finding housing that to trigger economic impact due to the financial constraints. If they are already below the federally funded housing level, housing is also the Institute reported that in then there are only 47 rental units available for every extremely low income family. This is a significant shortage of affordable housing in New Haven, which may compel families to assess substandard home. Consequently, that may have limited ability to address and eliminate known asthma triggers. Easy visits, as I mentioned, for asthma are an early detector of housing. Emergency department visits for asthma are an early indicator that housing inspections as a whole. This approach represents a novel method for the early identification of and to help to reduce asthma-related morbidity and mortality. And that was also the Lancet Public Health study just last 2 years ago. We also have the environment. I to attend. I'm not sure if they'll be here tonight, but I wanted to highlight the environment. And so we have exposures to certain environmental triggers that also play and contribute to the asthma as incidents in our city, especially among low-income neighborhoods, such as triggers include air pollution, cigarette smoke, pollen, mold, spores, mouth allergen, cockroaches, chemical fumes, and gases or dust. And so a large portion of air pollution in New Haven comes from motor vehicles as well. I know that we've been taking a big initiative in the city of New Haven and getting a lot of our vehicles to be electric. The health department being one of those first departments. Supporting that, my personal car is electric as well, trying to transition and move us from contributing to some of these effects and particular matters that are impacting individuals. Connecticut is also downwind of coal and oil burning in the the Midwest and South, leading to air pollution emissions from out of state. New Haven is often cited as part of the tailpipe of the nation due to pollutants from out of state sources. And so that's also really relevant to highlight. Schools. As children spend most of their days in the school system, the school environment is so crucial in understanding the preventative measures. Increased air circulation and air quality in schools have been linked to better performance, as you all know, before we reopened for schools after COVID. We worked really closely with the school systems in monitoring the air filters for them. Both the staff and the children were having safe places to study and learn as well as work. But we know that poor indoor air quality increases test scores. So maintaining the requirements for HVAC system and then having a system in place is really critical because it's been done. We're required to do that ventilation inspection. So just making sure that that continues. So what has the New Haven Health Department done to try to alleviate this issue and solve a particular problem? We have the campaign program from 2016 to 2019 until we unfortunately lost the funding for it and the funding priority shifted from the federal to the state level and then to us at the local level. But that was such a successful program, and so it was important for us to highlight the campaign summer camp program, which was our mission was to give caregivers assurance that children will be able to have a safe summer camp experience despite having asthma and having clinicians on site to be able to assist. We had the Putting on Ears initiative. Actually, it bumped into a provider who's going to be giving testimony tonight about how it was so vitally important to have that initiative as well. And it was Region 6 and Putting on Ears program. And we're a partner for 15 years with the Milford Health Department serving as the fiduciary. And the PDA program identified difficult to manage asthma cases conducted in home. A number of in home assessments, provide resources, and the health department distributed cleaning supplies to the New Haven families referred by the program. And the DPH decided not to renew the contract with the local health departments because it was difficult to fund beyond that funding period. So that ended August 31st, 2024 because of reprioritization. And so that put us in a difficult position. HUD is one of the things that we are currently funded with the Healthy Initiative as well as the lead hazard control program. And so we have those two programs that exist. And also, for example, with the lead abatement program, it is identified in the home. We can update $1,000 if there be major expenditures additional funds. We can approach the funder to get special permissions beyond $15,000. HUD Healthy Homes program funding available is up to $10,000 per unit, and this one is not restricted to age for age, for example. So, like with the lead abatement, we prioritize funding for children under 6 are impacted, and we receive for other levels greater than 5. Whereas the healthy homes can remediate problems that are identified in the apartment to reduce asthma and other triggers that can impact the quality and well-being of someone's life. Both programs are zero interest for a 5-year term and forgiven at the 20% per year through the loan amount term. So essentially, it's a grant, but if someone decides to sell the home will be before the 5 years, will be responsible for some of the grant costs. Nevertheless, for the most part, it is a grant. And so participants of both programs documented lessons improvement and through educational outreach sessions. Families are given supplies such as HEPA vacuum cleaners, HEPA air purifiers, air humidifiers, microfiber cloths, sponges, buckets, spray bottles, cleaning solutions, and families are also educated on how to properly use the cleaning supplies. That's in give out supplies, do a lot of education sessions. And I want to thank many of the alders who hosted us throughout the city over the years. And we hybrid ones as we will find it to go side. We are kicking off in the hybrid models so that people can also join on Zoom and still be able to get the education and access to the supplies. As you all may recall, we also, the mayor also announced the air quality monitoring program. Monitors here is a very transparent process, is live, and the different neighborhoods are outlined on the slide. So I won't read all of them, but there are 11 locations total where we're monitoring ongoing air quality and city-owned properties so that we can be able to be in that. Just giving an illustration of the different monitoring locations in the state. This is just a visual. And the next slide is also a 12-hour air monitoring data result. It's like if you log on to the website right now, it's 12-hour monitoring data. What we're looking to do here from in this past is looking at trends for the future. One of the things that we also do at the health department with our public health educator is when the air quality is we are concerned, we make announcements on different platforms so that the public can be aware of taking necessary precautions so that they can stay indoors if the outdoors is posing a danger. The air control monitoring does the sensor counts the particles that come in and measures the intensity of the reflection of those particles, and the measurement is translated into a number in micrograms per cubic meter, and fed quality monitoring devices. This monitor measures the particle matter. That's what is aligned with BoA. And so the sensors are for informational purposes at this juncture. We also rely on as another metric to announce those as well. And so as I wrap, in one of the things that presented, so all of the as potential community health that can focus on multiple public health issues. Most of our staff, well, no, 84% of my funding are grant positions, have grant specific have a community health worker list to focus on other conditions that impact the public. So when there's loss of funding, we can at least have a dedicated general funded person to carry on some of the responsibilities present for the public. And also funding supplies beyond the funding period that we continue offer supplies so that families can have those available. They are costly. Many families, really low poverty level, and so just need support. I think lastly, the things that I'm opposed with is collaboration with food partners and things that I'm looking forward to and leadership. I was limited to settle. I am going to be convening with them in the new year and ways that we can specifically partner because there are opportunities that there's health organizations that are within his purview and his team that I can come in and provide all those resources from the example. And that's one of the cons of what we do housing and residents. And so it will be great for us to be able to just come up with a streamlined process to implement that in the near future. So with that, I'm going to close and open it up for any questions that we all have.
Well, thank you so much for the presentation and all the details. And also great to see recommendations for next steps. That's what we want to see. So I'll see if my colleagues have any questions.
Thank you, Mr. Chair. Thank you so much, Director Vaughn, for being here. This is a few questions for you. The ventilation rate for schools. Did you say that that was measured 2 years ago?
So during COVID, we had like the gold standard. I always joke around saying that we even have the gold standard in comparison to like in the country where we did not open until like every school had a thorough inspection. And so we had a task force that were all big part of the country, and we inspected and worked closely with the Board of Ed on ensuring that all of the filtration, air filtration systems, they were changed and ready to be served. And some of them were like service. And so that maintenance needs to continue beyond us because that was specifically responding to the state happening after COVID.
Do you happen to remember that time what the ventilation rate was during the
I
inspection?
don't have that data. I'm sure that the maintenance at the Board of Ed had like they had a spreadsheet of all the inspections, and we were tracking.
Do you know what you have a recommendation on when there should be a inspection or a requirement for reinspection?
So we know that the filters of the HVAC systems are usually changed by season, like in your personal homes. And so we would need to look at the Board of Ed and their maintenance schedule and what they currently.
And just a question about the HUD programs. Do you have a sense of what the usage has been of both of those programs? Just
Yeah, I don't have the data in front of me, but that's a good question. And I actually made a note, put the data in, and I forgot to follow. We were,
You put a lot of-
yeah, we had a 2-day retreat actually, the last 2 days. I didn't get a chance to follow up with that team, but we had to get that data.
that would be really helpful. And just in your experience working with so many different organizations, what tends to sometimes stand in the way of using?
I think awareness, also, so awareness is one of them. Also the landlord has to apply. And so we have to have, so the resident can be interested, but the homeowner needs to apply. So the dynamics between that. We also, in the middle of COVID, we're not able to get into people's homes, so we had to launching that initiative, and so now we're back on track, ensuring that we are out there. So one of the things that we work diligently is getting out to the community. And so we've been trying to be present everywhere. We also did a media campaign so that we can promote services. And so working in partnership with the library, with the CNT, with many community grassroots organizations so that we can get them on the levels. So we actually have been working with these organizations.
That's really helpful. Thank you for that work. And I have more questions. I'll just one more, but I'll pass it to Chair. Just on that, these are great recommendations, especially on the operational side. On the policy side, do you have any recommendations, ways that we can partner together?
No, I think, I think one of the challenges, and I think that's what we present, but it's a mold issue, right? So like, and the measurement is really hard. And so that's a policy that we recommended from the board to the state. And and there has been some guidelines in trying to remedy that issue. But sometimes that crosses with us because one of the things we're trying to reduce and the homes initiative is for that purpose. It's trying to make sure that if there are triggers in the home, how do we reduce that issue?
Thank you, Director. Thank you, Mr.
Great, Smith. Other questions? Officer.
Thank you, Mr. Chair. Thank you, Director Bond, for coming out and the presentation. Question. Let's say a family member diagnosed with asthma and they're being hospitalized. Does the homeowner get informed or tested them?
No, it's not required.
Thank you.
Matt? Any other questions? Please.
On this slide,
Yes.
this is surprising to me that we're number 7 in the country for prevalence. And also that Bridgeport and Hartford are right next door to us. Do you have an understanding of why? Why would we be behind York? And
I think one of the things that I mentioned one of the things that I mentioned in one of the other slides is the highway and so many vehicles and going through us. And so one of the things that I mentioned, I'm just going to go reference it really quickly so that we can point it out. After that. Right. So we are considered the tailpipe of the nation because of that. Because and I think one of the things that has been a problem we all know is that Connecticut, it has refused to do tolls to try to replicate some of the, and so like every other outside states are doing it, and then Connecticut is not to figure out how to get some environmental control of people bypassing our state. And so yeah,
It still does seem alarming. Yeah, that's like part of it, but
and we also have one of the highest poverty levels in poor housing conditions, right? So the other component is having one of the largest housing stocks. If you looked on the other slide that I shared, is that houses built prior to 1940 was also highest among the nation, right? To the United States, and so that also our housing stock is just really old as well. You can change that unless you start, but yeah.
all right. Thank you so much for that information. It puts it in perspective. The other slide I wanted to ask you about is this one, the Vermont air quality.
Oh yes.
So could you talk about what accounts for some of these spikes? Like I see the Hill South, Morse Code, Tweed, where you see spikes. Like what do you think accounts for
And
those?
so
How do you respond?
we actually, Giovanni actually talked about this at the press conference, that if you look at the timing, some of it is when they might be preparing food and it causes the monitors to go up. So like if you're actually cooking, it causes air quality to go up, or if you are eating in the morning to just go to work and then it drops right back down. So it's just like certain times of the day, there's routine things happening where people are most mobile or most active in their homes, causes to trigger. And so definitely some scenarios, but that's something that we shared in a previous press conference.
So where you see spikes repeatedly, that's not like something that you're, oh, that will, because the cooking or having in the morning, whatever would happen everywhere, and you don't see the spikes everywhere. You see it really in those three, at least at this slide.
Right.
You see it in those three areas. Is there anything you correlate with?
And so that's why one of the things that we're going to be doing, and not my department, but I'm assuming definitely engineering and perhaps, I'm not sure, I don't want to assume on the department, but we're going to be looking at the trend, and what we're trying to do is look at knowledge of so we'll see what the future of us.
In what ways are you looking at Tweed? I receive a lot of complaints in Fairhaven about Tweed, just noise. And I know some of the immediate neighbors are cleaning particulates off their cars in the morning, like every morning. So that has to have some impact. I wonder how you look at that and what you're actually seeing.
So one of the things that we're doing, my environmental director is Ryan, who I think most of you know. And so anytime we get an inquiry or a potential report, we immediately contact D, because that is within their purview. And so we work with them, just making sure that we are up to date on any of the things we're concerned about. And so, and we take every report that's submitted seriously. And so we are in conscious of people's concerns and certainly monitoring it. Take is working closely with Tweed on addressing a number of things, right? And so if they are concerned, but right now they work very closely with Tweed, and so we just sort of are on standby, certainly watching.
In your observations, what have you, like what has been happening with air quality?
The air quality is similar as any other neighborhood that we're talking about, and so there's nothing alarming to the point that we need to raise concerns at this time.
Thank you. Thank you, Mr. Chair.
Excellent. I had one main question, which I'm interested in what you were saying about collaborations between city departments. It seems like that could be a lot of good work to do there. And you mentioned how hospital visits for asthma could be a sign that there's housing. Obviously, there's all kinds of HIPAA rules like that protect patients' privacy. But I was wondering if you have any thoughts about how we might be able to better connect families who are dealing with the health impacts of asthma with services from LCI and making sure that housing inspections are happening in those homes. I think that might be a reason that there are
Yeah,
violations.
I think that's a great idea, actually, a referral base, and that would just have to be a formal MOU partnership, right? So formalizing a partnership, contacting the emergency room, working with the hospital behind the scenes. I mean, it is possible for sure. It's just has to be formalized and with a data sharing agreement made to allow for that to happen because you want to be able to, as you mentioned, adhere. And then also the parents' permission. I think there's going to be testimony even today about a family in the hospital now in the exact issue. And so I think that's going to be very relevant to the idea that you just proposed.
Thank you. I want to welcome Jordan. Thank you for being here. Excellent. Yeah. Thank you for that explanation. It seems I'll be interested to hear from LCI in a moment and think more about those potential ways of working together with obviously healthcare providers in the city and making sure that we're connecting folks with those resources.
Thank you.
Thank you.
Our next presenter is going to be Executive Director William Brennan from the World Cities Initiative. Thank you again, Director, for being here. Name and address for the record.
Sure. Good evening, everybody. I'm William Brennan, 28 Elmwood Road. Good evening. I don't have a. Do you want me to just start? Or?
Please proceed.
Okay. I don't have a specific presentation. I want to have more of a conversation, and what I'm talk about is mold conditions of our residents here in the community. I think and the intersection of mold and asthma is really important. I suffer from asthma myself. It's really, really continuous issue for so many people and really impacts quality of life. But I think one of the most perplexing things that I found upon starting as director at LCI was the fact that we do not mold, because this would seem to be like standard in the central wheelhouse what we expect housing inspection to do. And when canvassing the staff in a time before I became ED, he was consulting with the city around LCI and what those, and then at the outset working as the director, really talking to staff members about what their experiences were, why we were not doing this, what's happening there, and then started looking for guidance from the state of Connecticut or other sources as well. And what I brought along with me today for you is actually the state of Connecticut put out in January of last year on this very issue. And I think it kind of speaks to what makes this very difficult for us as an agency and for the city as a whole, how to address the whole issue. Because kind of the headline piece of what the Department of Public Health for the state says is that there is no standard. There is no standard in any way to test air quality or housing conditions for mold at a healthy level. Partially, and I didn't know how this at first, but I would get a lot of this sort of same commentary from staff. Partially, the individual interacts with the different contaminants differently, so it affects some people more than others, like any sort of allergy. And partially because it is an intersection of various issues that lead to different types of mold. So this puts us in a very difficult position. LCI as an agency can enforce, like that is what we particularly. But here we are an all enforcement agency with a couple of ancillary activities of property management and relocation services. We can enforce if we have standards we can work with. We're not scientists and we can't come up with this ourselves. What we need to find as a city is a comprehensive way to evaluate when there is a problem. If we can find a way to evaluate when there is a problem, that is something then when we're working with landlords around town, we can do the evaluation and then bring it towards enforcement so that we can get compliant. But right now we're stuck in a position where we do not have a way to evaluate, and the state is not giving us much guidance at all along those lines. And I just want to bring this home by closing out with like an actual, this comes up a lot. So what we do when we do inspections, we see that there's something like mold, but we have no way to actually like test it, like that's actually mold, and is that so? There's a black substance, remedy black substance. How well the landlord remedies the black substance, landlord and some very well be cosmetic, they get over it, and we come back and it looks like it's not there, and we don't have hopefully a good responsible landlord will do more. We had a very specific situation here where we had a resident who was clearly suffering from issues related to mold. There's multiple residents, just one. She was clearly suffering from issues with mold. Was able to share with us ways in which it was affecting aspects of housing conditions. And you can see it kind of spores, not just on the wall where we normally see them, we normally see them on the wall in the bathroom. Like where there's a leak, you can see there's lots of things. But it was like personal things, staying in what seemed like a very nice place. But this has more issues. So we go into an inspection. We have no real way to evaluate whether there's mold or whether there's an unsafe level of humidity. Landlord has done all sorts of brought in testing companies and got air quality measurements and much more active than a lot of the other landlords that we find. But our inspectors and the fire marshal office being with us, everyone, we're going back to the reinspection, the building department members, everyone was that like that's unsafe place. That everyone being in there could feel and understand that this was affecting a mold situation and impacting the health of the family. So we ultimately condemned the property, relocated the family, but we're standing on very shaky grounds legally when we do that. It follows something of what the state says, and here is not going with you all. The state recommends use your eyes, test and smell, feel the air, and that's exactly what our inspectors did. But it's not something. Oh yeah, share with everybody else. Just keep on. It's not something we can really easily write up in or the level of humidity is something that doesn't feel like it's going to create mold, And so we have been having a significant back and forth with a very angry property owner. Understandable from his point of view, but have held out for a long time. Set remedy excess humidity. They brought humidity monitor come down. It lifted the condemnation since then, but I really trying to get stellar results from it. I don't feel very comfortable that this is a value tip point that you can see even in this case. It's kind of there. He's taken the steps. They don't have legal basis to maintain a condemnation, so we lift it. This is something that's going to come up, and particularly with climate change and like increased temperatures around here, we're probably going to see more of them along with older housing stock. This is something that I think is going to become more prevalent. So this is not set today, and for all of us, instead of a much bigger problem, something that does need to be addressed, but we need some additional guidance and standards to use to address it.
Excellent. Thank you for the presentation and for walking us through the challenges there. Obviously, I think we're going to hear later in the example you share, this is an issue that's a lot of our residents are confronting. So I appreciate you sharing the background. My colleagues.
Thank you, Mr. Chair. Thank you, Director. I just one core question to start, which is, in your sense of other states and other cities, who's doing this well, and what are they doing?
I don't know totally. There's not a lot to do with New York. We're trying to canvas now. That seems to have something about New York's standard. I think it's based more on humidity or water leakage. We're in the process of trying to get that now.
Thanks, Oscar. Any other questions?
More of a thank you, Mr. Chair. More of a statement. Director, and thank you. With today's building code and insulation and so forth, building are more airtight now these days. And our people does not maintain a temperature in the house. And with humidity and etc. It's trapped. And it does not, air does not move. So during the winter, you would see those stagnation of humidity because of the way your building your one and it does not move.
Do I hear you correctly on all this thing that kind of it's like a blessing and a curse sort of
Yes,
situation that it keeps our heat, our heating and that's what better.
Every chart shows that. You go back 15 years, we didn't have those mold issue with house. So that mold would grow. Because we focus on the insulation, not moving of the air fall.
Yeah, I do think one of the few things we do see that does help is ventilation and the moving of the air, like you're speaking about. Yeah, that's very important.
Those are some of the things that. Thank you, Mr.
Thank you for that information and for raising the issue. I wonder if you could speak to prevalence, like how broadly. I feel like I hear about this almost every week from a constituent, and not just in older housing stock. I also hear about it in new development. Go away for the summer, they come back and like all their stuff is covered in mold. We also hear about it almost every single August of people come back to schools, like classrooms covered in mold. And so it just feels like something over and over again. I appreciate your phrasing, but I'm wondering if that's just my perception or if it really is everywhere.
The covered in mold, I don't know how prevalent that is. This particular one that I was describing to you was one of those instances. Not inspection, but mold is an issue more on the walls. I cannot say a black substance that appears to be is like very regular. This is something that's a regular part of inspection. You can probably spot check. Pen or letters, and you're going to find it in there. And they're going on. So it is something that we see. That aspect we see regularly. I do have concerns that we will see more of that for the various reasons that we've all talked about.
Is there anything particular that you're looking for? Is there a legislative direction that would be helpful? Or we just raise the issue sort of as an awareness?
Right now, I'm raising the issue. I know it's been a concern for constituents. Alder Sabin kept me about his constituents. Alder Smith also her constituents on this issue, and it's something I want to talk about. This was raised a few months ago, maybe in a workshop then. I don't have a ton more information now, but I do think it's more very much as a gathering as well, and issue with bodies, but also. And so I think that's really important, and I think engaging communities suss out other solutions. What I found outside of government is that the community can bring a lot of potential solutions as well. So I think I'm hoping to bring this as like to get that ball rolling, because my point is because we don't have any right now only doesn't mean it's not out there, and I'm kind of starting the brainstorm process. I see this as a next really big health issue for residents here, and I would like to be in front of it as much as we can.
Okay, thank you.
Thanks, Alder Miller. Any other questions? So I have I was wondering when we're going through this fact sheet, but I was wondering if there's like just scientifically, is it possible to test a black substance and identify or a type of mold that's like?
So far, the available testing is not reliable. But I don't know that doesn't mean that's accepted. Maybe that's just stuff that's easily accessible is not reliable. I feel like there should be, but I haven't found it yet.
That's, and then the question I was wondering about is really to conversation with Director Bond from the Health Department. Wondering if you have thoughts on collaborating with health, with the health department, maybe with healthcare providers, hospital system, about trying to make sure that if there are folks who are being hospitalized because of asthma or things that might be related to their housing conditions, that we can figure out how to identify those people, or reach out to them, and if they have a landlord, figure out if it makes sense to schedule an LCI visit to catch those cases early. They don't know about resources from the city or haven't reached out. Seems like there could be some collaboration that would be helpful. Again, hip issues could be a problem, but just wondering if you have any thoughts.
Yeah, no, that's a great idea. I didn't have thoughts on that specifically, except that we've done some other things like we had engagement fairly talk about what patients see and then how they can refer cases to us. Let's start. And I do think this across the hospitals and health department would be great. I was thinking more when you started, and what I thought about is that I do need and want like scientific community to be engaged in like coming up with a standard or giving us some sort of standard. Then we could go out and test and enforce. Like that's what we can do with the standard. So we have a very good health department, and we have obviously a seat of learning here that we can engage with a lot of people and do that. And so that's what I work. But I do think, well, we should start small. Fair. That'd be.
Could you tell us a little bit more about, if you can, those conversations with Fairhaven?
Yeah, I mean, it's just kind of raising awareness of what we do, what kind of things you can see, how they can contact us, and what they should be looking for in residents.
So is the health center using LCI on behalf of about, or are they giving resources to the patients with them?
So I don't know if this has directly led to any direct complaints. Anyone could contact us directly as a non-resident complaint for you can always do it for blight. So for a property that you're property. You can do it for housing code conditions as well. You need the cooperation of the tenant or the property owner to get inside to inspect. So they could do it on behalf of a patient, but we still need to somehow interface with that patient to be able to get the inspection.
Of course, that. It's from Colin.
Thank you, Mr. Chair. One last question, Director Brennan. With the understanding that none of our scientists, although maybe older for those, but just to get a sense of it, like a North Star case, just to see if we can glean any insight. Do you have any cases, without naming specifics, where there was a black-like substance, where it was addressed, it was remediated in some way, and the condition was better? Do we have any examples of that, with the understanding that black better is something that is undefined, being addressed as something undefined? Do we have any examples like that?
There's ones where not, or there are, I don't know. I mean, I think there are definitely ones where if it's not there and we don't hear from people. I'm sure I could find you those. I cannot tell you that means it's fully not hesitation there. I get the number, reach out to something else. So,
Thank you, Mr. Chair.
Thanks so much. Any other questions from colleagues? Thank you, Director.
Thank you all. Thank you all for doing this.
And looking forward to continuing the conversation and trying to figure out how we can partner and keep working on this issue.
Excellent. Me too. Thank you.
So our last presenter for the city, I think, is going to be climate sustainability, who testimony.
Good evening, Chair Saban, members of the committee. Thank you so much for your time this evening and your attention to this critical public health issue. Stephen Winter, 459 Dixwell Avenue, Executive Director of Climate and Sustainability. I wanted to speak briefly about some of the intersections between environmental initiatives that the city is focused on and energy initiatives the city is focused on, and how they relate to asthma. I think probably the most prevalent example would be the tree planting work that the Parks Department does with citizens and businesses and the Urban Resources Initiative. We often hear that trees are the lungs of the city. And in many ways they are. They capture carbon dioxide, they capture smog-forming pollutants like nitrogen and sulfur pollutants, all of which can really exacerbate asthma and trigger asthma attacks. So if you're looking at the surface of a leaf, you flip it over, you can't see them, but a huge part of the area, the underside of the leaf, are little holes called stomata, which are actually what sucks in the air. So it's the kind of the opposite of our respiration. And all the pollutants I mentioned can get trapped inside the leaves. The interesting thing that I learned recently is that it's actually more complicated than that, and that's pollutants like particulate matter. So if you see a particularly dirty truck, it's building up a black smoke for engines. Some of our school buses, those are actually very fine particulates, which can also trigger asthma attacks. And those don't get stuck in the leaves, but trees kind of brush them out of the air, caught on the leaves, so they can sort of second way the trees stop clean our air. The city tree keeper website that the Parks Department maintains with URI quantifies the benefits of all of these different cleaning mechanisms and shows the value not just of the street trees, but also our forested natural areas. So if you think of our larger parks, a lot of this is happening in those. So there's a lot of value there, and also the way that trees help reduce the urban heat island effect, which has a lot of follow-on health effects. Other things that we're focused on, we do a lot of work with housing services and the state's anti-CT program to help residents access energy efficiency. And that can be an important tool for remediating oftentimes mold or asbestos get in the way. Those are the two most common barriers to doing an energy efficiency project. The state set aside a pool of funds, and through our ARPA funding, we've also set aside funds to help residents remediate those barriers so that we can remove mold and then help with the efficiency measures, whether it's windows or insulation and new heating and cooling systems. So that's an important piece. And then we're also looking through our work with the EPA, helping residents move off of gas stoves. So particularly in poorly ventilated areas, you're literally starting a fire. And if you don't have a good ventilation, there are nitrogen emissions and other growth emissions. So look at the data that's available. If you have an asthmatic child in a household with a gas stove, they're much more likely to suffer asthma attacks. So last year, through the Climate Emergency Task Force, which you all supported, we provided 6 countertop induction stoves to residents who participate in health departments' asthma programs. And 5 of the 6 of them said, "Hey, this is really great. It's in the summer when I cook all the heat goes right into the pan. It doesn't fill up as much. I don't have as much indoor air quality issues. One of them decidedly using demo. Um, and yeah, so I think that's an important thing to consider. Some people are very attached to their gas stoves, trying to rip stoves out of people's homes. But I think especially when people hear that there's real health impacts to their gas stove, there's cleaner or energy to do their cooking, that's something that they're interested in. And I think I was before the CSEP committee recently talking about vehicle electrification, and we're at the center of two huge highways. We also have a lot of vehicles, buses, school buses, refuse vehicles, street sweepers, most of which rely on diesel and contribute to a lot of the emissions I just mentioned, the smog forming emissions or the particulate matter. So everything we can do to electrify our vehicles is going to be reducing those air quality challenges and the asthma that people, young world, suffer here as a consequence of that. So, yeah, I think all of those things are initiatives that the board has supported, will continue to support. In the long run, I think we will see really large improvements in air quality, particularly if the state is going around bus electrification.
Great, thank you for that presentation. Questions from colleagues?
Thank you, Mr. Chair. Thank you, Director Winter. One question, you had mentioned that, apologies, I'm not sure it was for BoA, it's, the investments in weatherization to the things that we're saying, that homeowner or property owners do that was mold. And so two questions. One, what's that entity's standard for a valve? And then two, what are the mechanisms that are used now to remove that mold?
I think it's not like this area of expertise, but I think typically the energy efficiency contract, so there's licensed contractors, energy efficiency program, they will visually recognize, oh, there's asbestos wrap on this pipe, or oh, there's black mold in the corner, and then they would report that as an obstacle to energy efficiency. And if some income eligible funds are available, there's a program called REMS, which can pay for remediation. We've also set aside some of the ARPA funding for energy efficiency for remediation. So you have an abatement company come in and treat the mold or remove the asbestos.
It would be interesting to get more detail about how the energy efficiency contractors way of evaluating mold is potentially standard for a model. That's interesting. And then my second question is just a bit about it, like a little bit when you think about some things that we could do to reduce asthma risks, whether it's thinking about gas-powered leaf blowers or thinking about areas to have the sort of same effect as trees. Is there anything that comes to mind that you would recommend the city to do?
I mean, I think that looking at diesel, I think is a really important piece of air quality. So, to use the CT Transit example, the state's just starting to ramp its efforts to deploy electric buses. So those two buses are circulating through the city at most hours of the day, and contributing to all of the harmful pollution that I mentioned. So looking at vehicles or facilities that we know are contributing continuously to air pollution. The port, recently got a $30 million EPA grant. A lot of that going towards the cranes that move material there, and then the vehicles that move material once it's taken off of boats on shore. And those are, they're trying to unload goods as quickly as they can. So those machines are being run constantly. So getting them off of diesel and onto electric alternatives will make a really meaningful impact on air quality.
Thank you, Thank you, Mr. Chair.
Thank you, Ashna. Any other questions? Miller.
Thank you for the information, and thank you for the botany lesson. I wonder, did you see Director Bond's report on the air quality monitoring?
Yes.
I wonder if you monitor that as part of your role, and if there are trends that you notice that we should be.
It's not something I monitor regularly, but the climate task force was very interested in it. So the engineer presented on it to the task force, and one of the things that then meeting it was about some of the spikes at College Woods. He was saying that for a while they couldn't figure out, like, why would there be these large air quality problems in a park, and then the conclusion, it's not necessarily a very strong conclusion, but the conclusion they came to was it had to do with people who are grilling on the weekends, and that there's lots of particulate matter, there's lots of things that get burned, and so if you look at the dates and times, it seems to correlate well. But I think that the bigger story really is that there's a high level, or there's a fairly high level of particulate matter pollution that's fairly constant throughout the city. And that a lot of that has to do with the fact that we are this transportation hub, whether it's the highway, there's a lot of traffic there. And particularly those diesel vehicles have major particulate matter. So I think that's important to remember when looking at this is just particulates. So those sensors are just looking at very fine dust that's in the air at all times. So that's, I wish I could give you a more in-depth evaluation.
Did you see this? That we have a higher prevalence of asthma, like New York and Chicago. I find it very difficult to figure out I know these are not your slides. Wondering this idea of the intersection, highway, it's not, how can our numbers be that much higher than much bigger cities? Like, does that make sense to you?
The first thing that comes to mind is that we are downwind of that larger city, and we're downwind of a lot of industrial activity in the Midwest. And
or LA or Phoenix, if you fly into the sea, it's visible to the eye that you don't see here. I'm just wondering what is so bad here that it's not happening in other places, and or is this? I know you don't know where this chart is from.
Well, I have seen this chart. I think this is the 2018 Asthma and Allergy Foundation Asthma Capital report. I do know that in the last report I saw, we dropped significantly for whatever reason. I think Hartford. So I don't. Yeah, it'd be interesting to look at, year over year. Are we up there? But I do think part of it is that it's air pollution. And we have the local challenge that I mentioned, but we also are down, or the prevailing air currents bringing things from all over the industrialized parts of the Midwest. If you walk by the courthouse, right, you'll see the faces of the statues are severely eroded. Well, that's because there are many, many coal-fired facilities all over the West. Acid rain, they produced acid rain that fall on us. Um, there were coal plants here, but we suffered significantly because of that. We're buying a lot of those products, but we're also dealing with a lot of the pollution impacts of that.
Thank you. I think it's still an open question for me, how it is that we could be worse than Phoenix and Los Angeles and places like that. But I think it's just something to look into for the future.
Absolutely. Like I said, that's just one of the first things that comes to mind. Like, fair explanation.
No, I appreciate it.
Thanks, Board Miller. Any other questions?
Thank you, Mr. Chair. Your answers are really common sense solutions. If we want to live, then we'll make investments necessary so that we can have longevity of life. I am flabbergasted at the amount of asthma and the amount of other diseases our small city is faced with. So I'd like to ask about, because I'm going to be pushing this year, especially with your office, because I think that you all plays a vital role in helping us solve the balance between housing and green space. And so would you just talk, I hope that wasn't already covered, because I apologize for being late, it was another meeting. But would you talk briefly about the importance of maintaining green space as we are building all over the city with this urban design of everything right to the corner or right to the sidewalk, eliminating our green space, trees, plants, things that would help reduce asthma, would help autism, and that would help also help cure or at least diminish the effects of depression that we have in some of our urban centers.
Yeah, I think, Dave, thank you for that question. I think there's a lot to unpack there, but I think that a lot of it has to do with what, like you're saying, how we value different things and how we value our health and our quality versus, the city's growth imperative. It wants to grow, it wants to bring more people, more vitality in. But that can't come at the expense of our residents and their health. And for me, I think part of it has to do with making sure that there is space for everything, and that we as a city are being thoughtful about the role that green space can play properties that we control. I think that we have an affordable housing crisis. Everyone, of course, is very well aware of that. There's a lot of development trying to maximize the potential of lots. At the same time, we don't want to cover every square. We also have to look to where the city still controls its properties. I think that there's good opportunities for us to invest in additional green spaces on those properties that we control. Because we can say, look, we've developed this and this and this and this. We're planning to develop that and that, but we want to reserve these pieces for open space, for treatment, for vegetation, for all the reasons you mentioned. So I think that's part of it. And I think another piece of it that comes with a lot and still hasn't been fully addressed is the regulations around heat. And we have work to do there in the city with our zoning, particularly for parking lots, where if you look at like Hartford, for example, they have some standards where, I don't know them off the top of my head, but if you have X number of parking spaces, then you need to have Y number of trees. And that way you're reducing the heat island effect of these big open asphalt parking areas. So I think that looking at those standards is really important. Uh, and balancing, like you said, the interest we have in affordable housing and in developing or developers and trying to build units with having spaces on those properties for people to live in and enjoy. So I think, yeah, those are kind of three things. One is like, well, what are the other properties we do control where we feel like they can play a valuable role in providing people with access to nature, relaxation, recreation? How are we handling parking lots and the urban heat island effect? And then how do we balance the need for more housing with having some spaces for residents to on those at those developments have green space, have
How important do you feel sliver lots are to community gardens for the possibility of reducing asthma rates where community gardens with sliver lots are usually in areas that are very congested? The city is working to sell off many of the uses. Most of them are being turned into driveways. And so just wonder what your view is on that.
Oh, that's a good one. So I participate in my neighborhood green space, and I think that part of it really is about whether there's an interested group of residents who want to take care of that particular sliver lot. Block the green space, like all nucleus of people who are really excited about it. Working with you where I made some really nice improvements, planted trees, planted a lot of ornamental shrubs and flowers, and it's great. But there are other sliver lots, if you walk a block or two, where there isn't neighborhood interest and people are parking vehicles, or you have these growing or things that aren't beneficial. So I think it's kind of case by case, uh, looking at where we have interested groups that want to make the investment and where we feel like we have enough space where we can, build a house. It makes sense and people are interested in that. So I do think you got to look at each one. But I think a lot of these sliver lots, it would be better to have something built than to have it be, a dumping ground or something that's not maintained. And I think part of it is making sure that we're giving people resources, we're supporting those green space groups. But it can be challenging when people have jobs and families and they can't make it out every week to be a part of the green space. They have lots of other competing priorities.
Thank you. Perhaps your office, the site plan review for some of our new developments as we're looking at maintaining healthy or just maintaining health in our city. I'm very concerned about some of the things that we're doing and reducing green space. And as our diets are getting worse, asthma rates are soaring. And what difference does it make if we have 10,000 more people if we only need to be 30? Thank you. Thank you, Mr. Chair.
Thank you, Mr. Pedro there. Any other questions from members of the committee? Seeing none, thank you.
Okay, thank you.
All right, we've reached our public hearing portion of the meeting. I just want to say thank you to everybody for patience sticking with us. I think this has been a very valuable and informative conversation for all of us up here, and hopefully it has been for you as well. I really appreciate you sticking out here on this late Thursday. So we have a few people who signed up to testify. I don't know if there might be signed up over there as well. But first we've got Caitlin Maloney.
Can I touch anything?
Mhm.
Hi, thank you so much for this conversation tonight. My name is Caitlin Maloney. My address is 694 West Main Street in West Haven, Connecticut. I work at New Haven Legal Aid. I'm a community organizer. I've worked with tenants housing issues for over 6 years. So again, thank you for your time on this matter. So I'm speaking to you as a community organizer who is working closely with a group of around 30 tenants from a specific apartment complex in New Haven, as well as the Room for All Coalition, who is very concerned about these issues as well. And I'd like to share my public testimony regarding the urgent health hazards they are facing due to the neglect of their landlords. Over the past few months, or a year now, I've been working with this one apartment complex and have witnessed firsthand the alarming conditions within these apartments, particularly the prevalence of mold and other serious health hazards. For example, one tenant presented her landlord a letter from her doctor due to asthma issues and hopes to get a carpet replaced. It's been 7 months with no changes. Another tenant has mold under the sink and in her ceilings. She has a young child with breathing issues as well. And another tenant I know pretty well has had her asthma escalated recently and has to use a nebulizer for the first time. She was like freaking out about that. So these issues come up all the time. I have like a number of pictures on our phone from a group chat that we that goes with tenants, the struggle community there, and just the pictures keep coming. And so yeah, our group chat is just filled with residents. These ongoing issues with flooding as well. So there's like some structural issues at this particular building that have obviously led to severe mold infestations. And unfortunately, the response has been inadequate, often resorting to superficial fixes that merely paint over the issue, like perfectly in this as well, rather than addressing the root causes. So many tenants are suffering from asthma and other health issues exacerbated by this condition. There are numerous individuals who wish to attend this meeting tonight and share their stories firsthand. However, many of these have significant economic pressures that often make it difficult for them to participate in this one. So, you know, and also what we're seeing is many of them would honestly rather move out at this point rather than fight with the few resources that they have now. We've also seen maintenance retaliate against them, and they feel paranoid to speak up. Since we've been able to invest time at the complex and home, their rights and tools like the LCI or the commission, and since they've been showing up and using these services, cars have begun to be towed on a regular basis, causing up to $300 bills to retrieve their cars, $300 for these tenants to have. This is a systemic issue. They also begin to see higher eviction rates, or they just, again, they're hopeless. You know, they want to speak up, but you know, they're not able to at this time with these issues. It's just that are real. So I just wanted to show up and like record and acknowledge that like this is happening and just speak on behalf of them today. I urge the committee to consider allocating resources to assist landlords. It is expensive. There are like small landlords but fixing these critical issues, or at the very least, enforce the existing regulations that hold landlords accountable for conditions. Another idea is a disclosure requirement law, which other cities have done, where landlords need to disclose to tenants whether there is ahead of time, maybe incentivizing landlords to provide safer housing at the onset. I don't know how you'll be able to enforce this, but something to try about. But yeah, there needs to be more research done, and I think accountability should really be an important focus. And also, while mold is a huge issue, there's a lot of other housing causes that do cause asthma. For example, respiratory issues included are caused by like pests like cockroaches, dust mites, dampness, and ventilation problems, other types of air pollution. At the end of the day, the health and safety of community members must take precedence, and really immediate action is needed. So I'm really glad that you're having this conversation tonight, having conversations. Thank you again, and yeah, I hope to see full steps taken in New Haven to implement our system.
Thank you. Thanks for
your testimony for the work you do in the community.
I have a question if I may. Mr. Chair. So you came to testify about a place, but you didn't say where it was.
I can name it. It's Sunset Ridge. You've probably seen them. They're off of exit 8. I don't know the exact address off the top.
Is that New Haven?
Yeah, oh yeah, it's definitely.
Have they gone through the tenants that they've been in touch with LCI?
Numerous times with private leases. Honestly, I think they're one of like the tenants that live there. Legally, like we represent a lot of them. I have some colleagues here that can probably confirm that, but because I'm not an attorney, I'm an organizer, but yeah, they're like coming through the doors all the time. They know what tools they know. They were able to get to respond to their cases earlier in the year when Fair Rent Commission wasn't at one point. But yeah, we went through like really trying to inform them. So there are tools, right? But like at this point, they're not working because it's so systemic and just keep either getting evicted or like honestly losing open. So it's like really hard to support system.
Okay. I imagine you left your number with that.
I'll put number on the sign sheet as well.
All right. We'll circle back with you.
Thank you. That's good.
Thanks for doing the job.
Thank you.
Thank you. Next, we have Laura Chen. Thank you for being here. If you could give your name and address for the record.
Sure. My name is Laura Chen. I'm going to give the hospital address. It's 1 Park Avenue, West Pavilion 2, New Haven. Thank you so much for allowing me. My name is Laura Chen. I'm a pediatric pulmonologist and I work at Yale New Haven Health. I practice there primarily, and I take care of children with asthma in New Haven and surrounding areas. Unfortunately, we see in our community the clear link between poor air quality and asthma. Each year, each clinic, I take care of children with continued asthma attacks, requiring strong medications like oral steroids, or even hospitalizations, despite being on the maximum amount of medication therapy. Many of these families tell me they have mold in their ceilings or in their bathrooms, or even worse, standing water that happens in recent weeks. The New Haven Healthy Homes Program has been an effective way to subsidize funds to landlords to help address these concerns, but the rate of access is low. And as Health Director Bond has pointed out, the majority of families in New Haven are renters and not owners. It's also a way to help identify and advocate for mold remediation, but the program is no longer in existence. Currently, alongside general pediatricians and the medical legal team at Yale, and the community organization Hispanic Foundation. Our team, supported by the Community Health Equity Accelerator under Yale's Office of Health Equity Research, has launched a pediatric ambulatory program that focuses on asthma and social tolerance topics. Resources range from application, education, housing resources for doctors and landlords, like links to health homes, local city, LCI, smoking cessation tools, and actually a new asthma program. Through this program with efforts of Spanish and English-speaking promotoras or community health workers, families with children with asthma can follow at Yale Subspecialty Center. Or here at the clinic are able to learn about ways on how to improve their child's asthma, have access to advocacy tools already in existence, and free legal advice from the medical team. This is a small pilot program addressing a big problem. And some of our evidence-based efforts in this intervention include when to provide legal advice to families, to housing issues, addressing triggers, and medication. More resources are needed to amplify the voices of youth and community members based on conditions that affect their health and their children's health. Specifically, we would like all to consider: 1, lowering language barriers to share housing concerns. Now there's no way that New Haven residents who do not speak English lodge a housing complaint with the city housing inspectors. 2, protecting people who live in New Haven from fears of eviction and other deportation fears, with likely imminent changes to immigration policy. And 3, ensuring that the city housing inspectors are able to identify mold and cite it within their purview. As Director at the time, our patients are told that mold is outside of their purview. Thank you so much.
Thank you. Thank you so much for being here. Do we have any questions from members? Thanks again. Thank you for drawing on your expertise as we move forward here. So we really appreciate you being here.
Mr. Chair, perhaps you could leave with written testimony.
Yes.
I put a lot of notes down, if that's okay.
And next we have Cassandra Saxton.
Good evening, everyone. I am an attorney, with the New Haven Legal Assistance Association. I have a personal testimony as well as statements from a few of my clients about the ongoing issues for mold, other health-related conditions, etc. Yes, sorry. My name is Cassandra Saxton. I work at 205 Orange Street, New Haven. So as stated in the first presentation, there's a link between poverty and asthma. A part of that are the poor conditions, the poor housing conditions that certain landlords, quite frankly, are getting away with it. I've walked into several homes covered in mold with mice that love damp spaces, holes in ceilings, poor ventilation, just to name a few. Often people living here are low income, disabled, elderly, undocumented, or otherwise disenfranchised. These are people less likely to use the legal system, and when they do, they're less likely to be taken seriously or believed. So this is the first letter that I have. My clients, a family with children, have expressed concerns for their mental and physical health due to the poor conditions in their apartment. They have experienced issues with mold, moisture, and mice that remain unresolved and have caused respiratory distress, including exacerbation of asthma on numerous occasions. One member of the family wrote in a statement, "As a tenant in New Haven, Connecticut, I've been experiencing issues with my landlord for quite a while regarding specific problems, such as lack of necessary repairs, unreasonable rent increase, and failure to maintain habitable living conditions. My landlord has repeatedly ignored my request for repair, constantly giving me a hard time and blaming me for the repairs, which cost me and my children a serious mental breakdown. This is a clear violation of the Connecticut's landlord-tenant laws requiring habitable living conditions. We are not animals. We are human beings who deserve to live clean, especially when there's young children in the home. Despite repeated complaints about mold growth in the bathroom, my landlord never sent anyone to fix the issue. The house is peeling paint, broken and ill-fitting windows, and more, yet my landlord continues to charge high rent without addressing these problems. This neglectful living for tenants has to stop. It's not fair how we have to continuously pay high rent when landlords are not doing their jobs to keep their tenants clean and safe." As my client pointed out, ill-fitting, broken windows have let moisture in to fester in the family's apartment, leading to damp, moldy conditions, a breeding ground for mice, as well as infection and disease. The average rent in New Haven is well over $1,000 and steadily increasing. Families are finding it increasingly more difficult to live affordably in New Haven, made worse with adding medical and mental health treatment debt linked directly to the lack of accountability on the part of landlords and maintaining safe, dry conditions in their buildings. Evicting tenants will not solve the issue. It only silences speaking out. These are not one-off occurrences, but a systemic issue that demands resolution. As part of this first letter, I have some pictures of mold that are in this apartment. My printer is not the best, but the black spots and the reddish discoloration that you can see are where it is currently. I don't know. So just give a minute for those to pass on. But while those are passing on, I'll read the second letter. So the second letter says, I went to the hospital today to visit a client with a respiratory condition. I asked her if she'd like to make a statement for tonight's public hearing. She agreed, stating the following. I've lived in my apartment for almost 20 years total. I've had this respiratory condition for around 5 years. Around 2 years ago, I started to suspect that there was mold in the house, maybe in the basement or walls, because I kept seeing areas of moisture in and around the building. For almost 2 years, my condition has been getting worse, causing me to be in and out of the hospital every month. When I'm in the hospital, I start to feel well, but after a few days being back home, my symptoms get worse again. So I eventually have to go back to the hospital. I've asked my landlord multiple times if there's mold in the house. I've told him my condition and the concern that mold is causing it to be worse. I've called and emailed asking him to check for mold, but he never answers. I've called LCI and the Section 8 representative, but while those reports are pending, my landlord still didn't answer me. Instead, he sent me a notice to quit from that time. My family is worried about my health. I'm also worried. I was on FaceTime with my daughter, who also lives in the house today, and I saw large chips in the paint on the walls. At the spots where the paint peeled off, I saw wetness and it looked black. It didn't look that bad before I went to the hospital earlier this week. I think it might have gotten worse after the rain we had this week. I'm tired of the hospital. I'm also not looking forward to going home, but moving is a long process. I'm tired of feeling sick and being bored. Other people are also getting sick. It's terrible. They're going through it and don't know it. It makes you scared to breathe. It's sad. Like many tenants in New Haven, are paying top dollar sales or subsidies to live in these buildings, yet are being denied safe housing. At an even more basic level, they're being denied access to information regarding the conditions of their housing. The public should not be required to accept housing conditions known to cause and or exacerbate serious health conditions such as allergic reactions, asthma, COPD, and more, or else face retaliation by their landlord, housing insecurity, medical debt, or inaction from their municipal authorities. I'm more that we work together to find a solution that addresses this public health concern. So the solution that I'm suggesting, as well as a couple of my colleagues from New Haven Legal, and I know they're with about this, is a municipal code to address these concerns. I understand that addressing mold directly can be challenging to say the least, but I think a good step might be to address the underlying moisture that's associated with the mold and using allowing mold to be evidence that there is moisture in somewhere in the building or in the apartment. Another issue and suggestion is access to information regarding the condition. A lot of my clients are trying to get their reports, whether it's LPI reports, Section 8 reports, or inspection reports, but it's not as simple as just asking for it. There's a process that's involved, and in the defense against certain eviction cases, we need the reports to show evidence that there was an underlying issue, and it takes a long time, and housing court is pretty quick. I think overall, it's unacceptable that I have clients who have medical conditions that are life-threatening, and their landlord can just ignore them asking about it, and there's no standard for anything really to be done unless she moves in. And again, although one client might be able to do that, I'll be able to hold that. What about the clients with children? The clients who have to move their children to a different school system because the same landlord owns a huge number of properties in New Haven. And if they leave this property, are they going to allow them to another New Haven? We have a lot of low income, undocumented, disabled, elderly, and otherwise disenfranchised tenants being pushed out of New Haven in favor of sweeping these things under the rug. As we said in some of these presentations, there's a huge issue with mold, with asthma, with different respiratory issues. And again, part of it is the conditions that are accepted in these low income areas. And I think that's the correlation, one of the correlations. There are several, but one of the correlations between the high numbers of asthma that we see and the high numbers of people in low income with low income status.
Thank you. Definitely. We'd like to connect with you after to identify, if we can, those tenants are dealing with those issues, and you can connect with resources and make sure that LCI and BoA are aware of those problems.
Of course, I have my work phone number and extension written down on the sign-in sheet and in the speaking sheet today.
Okay, we'll follow up. Any other questions from you?
I do have a question. Thank you, Mr. Chair. And I don't know if I don't want to go off of, because we're talking about asthma, so I don't want to go too far off. But one of the things I've heard it mentioned in a couple of testimonies about eviction. Is this eviction because of non-payment? Why are they getting evicted?
Many of them are some evictions. Yes, many of them are.
I don't want to get too much because that's
Yeah,
not our topic tonight, but only because I've heard it twice. I'm just wondering why people are getting evicted. Okay, thank you. Thank you, Mr. Chair.
Thanks, Will. Thank you. Thank you again for being here. Next we have Shelley. Right over here.
I get too close to you guys, I have a really bad cough. So if I sit back a little bit, it's okay. Thank you so much. My name is Shelley White. I'm the Director of Advocacy at New Haven Legal Assistance, and I live at 143 West Rock Avenue in New Haven, Connecticut. And I'm sort of echoing a little bit what Cassandra had testified about. It's our position that a lot of this is caused by a lot of the asthma. One of the things that we really want to focus on is housing conditions. One of the major housing conditions that we see that is directly tied to asthma and related to respiratory illnesses, especially in children, is water and leaks. And so I wanted to sort of take it back to Church Creek South as a cautionary tale of what happened to not maintaining that property over the years and how we lost 301 units of affordable housing. Church Street South was set up of 22 different buildings, and it admittedly was probably, in hindsight, not very well designed with these flat roofs and what have you. But the tenants were relocated in 2016 and 17, and the property was obviously demolished in 2018. Now we just have this piece of land that hopefully will be redeveloped in a healthy way. What we discovered over the years was that, and this was an open knowledge, was that they had leaking roofs. We all know about the leaking roofs. The flat roofs were leaking. They had leaking pipes. There was dampness everywhere. They said that there was visible mold. There were problems in the walls from all the leaking roofs and the windows, poor ventilation, and most importantly, painting over the cracked areas in the wall where the water had accumulated from coming down. And the estimate of the number of people that had asthma at Church Street South was 48%. So what Dr. Bond testified to is that in New Haven, it's about 17%, and that's much higher than we see even in the state of Connecticut. It was 48% at Church Street South. And we know that from, that there is a direct correlation then between the visits that children have to emergency rooms and hospitals and the poor housing conditions of their housing. There is an article, I think, I'm hoping that you read about it, called In These Times by Tom Birmingham. And I think that he highlights Sunset Ridge, which Caitlin testified about. Sunset Ridge, to me, is sort of the next Church Street South in many ways. I don't think it's quite as large as Church Street South, but if there's many parallels there in terms of the property having extensive water damage and a number of people that are reporting respiratory and asthmatic conditions. This is a real challenge, we understand, but we don't think the issue is really about, quote, testing for mold. We think the issue is about presuming that mold is dangerous and that mold exists wherever you find water. And there is, was interesting to me because there are a number of states and communities, New York, Colorado, I shared them with Leah Brennan, that have adopted more stringent requirements regarding inspections around water, that anytime you see damage about water, it has to be. But what I was kind of surprised in reviewing again sort of the Church Street Health, the litigation around it, is that there's quite a number of housing code provisions right now that deal directly with checking out for roofs and making sure that they're and windows, to make sure there's water tight, dealing with leaks in the bathroom, leaking pipes and things of that nature. I'm not positive that we don't already have the tools. I think we have a culture sort of within livable city, which is that we don't test for mold. And somehow this idea that there's some mold that really isn't bad. And maybe a little bit of mold around, some of the outside areas of showers or what have you, and we can brush that away, perhaps. But overall, I think presuming that there's some mold that is sort of like presuming that there's some lead levels that are really not that bad. It's all, once you have the water damage and what have you. I did an inspection with an LCI just maybe about 2 weeks ago, and she's had persistent water issues in her apartment, and they're coming from the third floor, and the third floor has an open complaint. But they weren't on the list to be reviewed that day. I'm sure that they would have been happy to be part of the review. They're connected to the second floor in the sense that they have water leaks on the third floor that are affecting my client on the second floor. But we do it so with blinders on, I guess is what I'm trying to say. We're only dealing with the second floor that day. And she told me how the landlord had put some boards up where the walls had been sawn, boards up, and he painted over them. And the inspector, you could see that, it was there, but it passed that part of it passed inspection. Other things did not. But painting over, and they just wait until the water comes back down again, cracks open the wall, the paint in the wall, and then it's like, okay, now we'll deal with this. She told me how anytime it rains, the walls become soft to the touch, and that will trigger an inspection if LCI is inspecting them for an order. But when they come back, it's just painting over. I just passed this, but one of the ways this was really kind of falling was that there were mushrooms growing in her client's apartment, and they covered them up. And I said, did they take them down? No, she said they covered. The landlord was allowed to cover them up and paint it over them. Here, I brought with me which I'll leave this, the Landsat report, which is mentioned in Director Bond's testimony from 2002, which basically focuses a lot on New Haven and on ER visits in New Haven directly. The doctors directly correlate that to that housing. And also the expert reports for the two experts, or two of the many experts in the Church Street South litigation, which both also talk about the correlation between housing conditions. But I do think that really we may have the tools, we may just need more focus on this as a priority, and understanding that this is on par with making sure we have smoke detectors, so making sure we have two means of egress in case of fire. For me, the next thing is after fire, and carbon monoxide is this water issue and causing all this, causing asthma and respiratory conditions. People lose time from work, children are absent from school. The economic impact of this is enormous. And it's, I guess the hardest thing we see today is the number of tenants that come back to us. And if we have the time to find out they live Church Street South, it's painful to realize they live Church Street South, just in another really bad situation, health-wise. So that's really all I need to say. And questions, I also do have my phone number. Thank you.
Thank you.
very much. And thank you for starting this conversation.
Any questions? Maybe not a comment, but I hope to make it back in touch.
Okay.
To continue this conversation.
Thanks.
Thank you for being here. And the last person on our signed up for testimony is Daniela. Heard it?
No, you got it right. It's just her again.
Okay.
Daniela Hurt, Street in Connecticut, apartment 4. Okay, so let me just get my thing. Okay, so I've lived in New Haven my entire adult life, and I do really love the city. But now I'm like starting to actually have to think about moving because it's like even when I leave the current apartment that I'm dealing with, every apartment is like this. Landlords in New Haven take advantage of the poor because we can't afford anywhere else, and they take advantage of us being afraid because we aren't listened to and the landlords retaliate. Older folks in New Haven, such as my best friend who lives near Science Park, who used to be insured poorly, so they just accept it. And some people like him are not even aware of how serious the danger is. I myself have been living with issues for almost a year and was subjected to death. They even put a stop work order, and they continued to come every single day for 3 weeks. Now the stop work order is just over, I guess, and which means wars were released, and I was subjected to what it does because I signed the legislature form. So I know that there was my landlord ripped down all the walls with lead in them and then just covered the black mold on. I've told my landlord about this numerous times, and they sold to a subsidiary to avoid liability. They actually got in legal issues with the court with the to avoid liability. I then brought this up to LCI and have been really trying to get help in September. And LCI twice told me that it was not their responsibility because I'm on Section 8. When Section 8 did an inspection already and I don't know why they continue to fail inspections, but the department has not been put into abatement. And in my opinion, what contributes to it being as bad is our tenant rights are not strong enough. A lot of the exposures coming from our homes, I mean, we can plant, trees and stuff like that. It's not going to do anything because people are getting sick in their houses. And for example, in California and New York, they have really good tenant rights. You can even see compensation for being exposed to the stuff for loss of wages. And I already have chronic health issues and they're getting progressively worse. And it's kind of nuts how I constantly have a 24/7 migraine in my house. Within 10 to 15 minutes from leaving my house, it stops. Start holding these mega landlords accountable. There are literally 3 companies that own the majority of New Haven when you are in poverty. It's all you can basically afford to rent from. And we will all continue to sadly suffer, especially our most vulnerable. And the most important thing we need to do is fix the toxic environments because they don't care. They allow them to fester, and way too many of our residents home, as well as explain the signs to people who are not aware of how dangerous things are so that they know they have rights to involve. Because a lot of the time, we're calling for anything. And the city seems to focus on building things for our wealthier residents, including, money to build, luxury apartments versus fixing things for seriously vulnerable people who can't afford to lose everything. And I myself ended up with a notice to acquit for reporting the improper handling of the apartment. And I'm sick of being out of organizations. We need help. Thousands of people are living like this. It's not okay,
you so much for being here and for sharing your story.
And I have pictures too of the apartment, like, they actually like blew out the wall, which was kind of nuts.
Yeah, I think we'd like to follow up and make sure that Elsie has.
Okay, and my lawyer too, let's just do this accent. It's basically a loop. I have questions.
Anybody else who signed up to testify, so I will ask if we have any other members of the public wishing to testify this evening. The second time, are there any members of the public wishing to testify? Third time, seeing none, do we need to close the public portion here? Second. Hearing moved and second, all in favor of closing the public portion of the hearing, please say aye. Aye. Any opposed? The public portion of the hearing is closed. At this point, do we have a motion to file the item moved and seconded to read and file discussion? I'll just say that I'm very grateful to everybody who came out to testify tonight, city staff. I think gave very thorough and detailed reports on a whole bunch of different issues that together contribute to the challenge we face related to public health issues. I'm particularly grateful to advocates and residents who came out to share their stories of these issues impacting them personally. It's easy to see numbers, but when we hear from real people, it's even more impactful. Thank you, especially for being there so late on a Thursday night. And also want to thank a colleague from the 27th Ward for raising this issue and bringing it to committee. I think that there's lots more work to do, and I hope we can continue the conversation and bring some action forward, hopefully, to help. So, any other discussion? Yes.
Mr. Chair. Yeah, I feel emotional right now. And this feels really personal. I've had neighbors that have been displaced because of mold. Less related, but it came up because of neighbors that were placed fires. My partner has asthma. I echo gratitude for the stories and expertise of those that testified tonight. People came to us tonight with quite a few potential solutions, and I think it would behoove us to look at many, if not every single one, and review them to see what we can do for our city moving forward. Thank you, Mr. Chairman.
Thank you. Any other discussion on
I think sort of heard from Director Brennan initially that he wasn't really sure what next steps to take. We've had a lot of really concrete suggestions. I don't know how viable they all are, but through you, perhaps we could ask staff to compile just a very concrete list of what we heard so that we can look at them and evaluate them.
Definitely agree, and I think we'll be maybe talking with leadership about whether some kind of working group or something like that to come out of this meeting, move forward and try to identify some of those solutions and see what we could take action on.
Thank you, Mr. Chair. You can certainly make that to request a working group to work on this item. That would probably be the best way to do it.
Hearing that, I will move that we create a working group to.
You should probably. Go ahead.
Just to make sure that I'm secretly doing that correctly.
Yep.
I'll make a motion to create a working group to together resources and ideas to address related health challenges.
Chief Creative Working Group. I don't know that we can. But,
Maybe we can second it and perhaps we'll iron out some of those details. But all in favor of creating a working group, please say aye.
Aye.
Any opposed? That motion passes. Back to our previous motion on the motion, read and file. Seeing no further discussion, all in favor of reading and file, please say aye.
Aye.
Any opposed? I will now entertain a motion to adjourn.
So moved.
Okay, motion seconded. All in favor of adjourning, please say aye. Aye. Opposed? Thank you all.